Here we go. In the spot. You know how you wake up in the morning and look past the seafoam specks of dried toothpaste to see your face and think, is this the day? Is this the day that I see that spot on my skin that I've never noticed before? Is this the day that I get a pain in my arm or a tight feeling in my chest? From time to time, I have that basic apprehension, that flash of fear. It may only last as long as it takes to form the questions, but it's disturbing nonetheless. And at my annual birthday checkup, my GP Barry, who's been my doctor since the early 90s, always likes to go over the results of my blood tests. So he's standing at a computer looking at notes when he turns to me and he says, I've got good news and bad news. Which do you want first? All right, what's the good news? Well, your bad cholesterol is way down from last time. You take the statins every day, right? Yeah. Well, that's the good news. The bad news is that your PSA has gone from 3.4 to 4.7. So I ask, what does that mean? So he says, PSA is the prostate-specific antigen. I check it every year. It's a marker for prostate cancer. I'm getting a chill. So do I have prostate cancer? No, he says, don't worry. It means you only have about a 20% chance of having prostate cancer. My stomach falls to the floor. So I ask, what does a prostate do anyway? What does it provide? I'm already picking out my clothes for the funeral. The Paul Smith suit, the Armani tie. In my mind, I'm a goner, but I'm a well-dressed one. So, of course, while waiting for the first meeting with the urological surgeon, I read everything I can about prostate cancer, from website to website, looking for anything that will convince me it's a false alarm. But nothing really looks good. It all seems to be bad news. It's especially cold comfort to realize that 1 in 9 men over 40 will be diagnosed in their lifetimes with prostate cancer. Hear me, 1 out of every 9 men over the age of 40 will get it. Now, the urologist's office has treatment rooms which double as consulting rooms. So there's apparatus for various procedures and posters for numerous ailments of the urinary tract and reproductive organs, profusely illustrated. This urologist, I have shoes older than him, is very straightforward and explains that life will go one step at a time for the foreseeable future. From MRI to biopsy to genetics test, and at every stage, there's the part of me that says, well, it's only a 1 in 5 chance. Then the next tests make it a 50-50 chance. And then there's the biopsy. The biopsy is performed with the patient supposedly under general anesthetic. I recall passing out, but then being in a twilight zone haze where I could see and hear and feel what was happening. Then I'd go under again, but ouch, biopsy. They use a spring-loaded needle that takes tissue samples from the suspected sites of possible tumors. Now, every time I have a test, I have way too much time to think about the catastrophic scenarios. And then one day, there it is. Dear Mr. Brill, I hope you are recovering nicely from your procedure. Your prostate biopsy pathology shows 2 areas of prostate cancer that have intermediate risk. My office will set up a time for you to... The penny drops. Cold reality seeps into my otherwise comfortable process of denial. Next time I see the urologist, he goes through all the options. I can have a radical prostatectomy where they remove the prostate and a few other adjacent bits I might be able to do without. There's seed radiation where they implant little rice grain-sized radioactive beads that are meant to kill the cancer with hopefully few side effects. There's hormone therapy where they kill all your testosterone off. And there's beam radiation. But I really don't want to live in diapers ever. So I opt for a robotically assisted prostatectomy. Just take the damn thing out and be sure you get it all, otherwise big problems. By now, everybody I know wants me to talk about prostate cancer with their friend who had it. My pal Mike, you really should talk with him. He had a terrible time and he's still suffering massive side effects 3 years later. I think he had a catheter for like 6 months at least. Just stop. Okay, I don't need any more horror stories. So anyway, the morning of the operation, I'm doing okay until I get through the hospital registration and they take me to pre-op, where a nurse tells me to change into a gown. That's it. Boom. That's the moment reality floods in and drowns my denial. I'm all alone. I'm in the blue gown that's open at the back, wearing the fuzzy blue hospital socks, lying on a bed in pre-op. I'm cold and I'm going through endless checklists with a nurse. No allergies to medicine, no allergies to latex, any previous cancer, no. Okay, So the thing about robot-assisted prostate surgery is that it's a cross between those claw things at amusement parks where you try and grab a stuffed purple bear and a virtual reality arcade. Check this out. The surgeon sits under a hood in some kind of VR helmet display. The patient lies across the room on a table that's slanted in a sort of 10 minutes to 4 position with their head tilted down. The actual work is done by the 5 robot tentacles that descend from above me with all manner of cameras and instruments to make 5 tiny, neat incisions in my abdomen, and poof, off we go. Don't worry, this time I'm thoroughly anesthetized, and that's all. I wake up in a massive narcotic cloud with an almost pleasant ache somewhere below my waist that's far enough away to seem rather familiar and somewhat chummy. In reality, it's the monster that rises coincidentally every 4 hours as my fluffy comfort cloud dissipates. For any going down this surgical route, be prepared. Major abdominal surgery has a massive freight train of an impact, and recovery is no picnic. In the end, it's all about patience. It takes 7 weeks for the prostate-specific antigen or PSA to leave your body after the prostate that manufactures it is removed. Then I take a PSA test. I'm terrified that it'll show that there's still cancer in my body that's spread beyond the prostate. That's the big worry. Thankfully, I have no measurable PSA, which means I'm clear for now. They got it all. So now, when I wake up and I look in the mirror past the seafoam toothpaste specks, I can check one thing off the list. No prostate means no prostate cancer. Now, what about this spot on my face? Was that always there?